But the people who can make a difference is each one of us. If each one of us does the right thing, we'll break this chain of infectivity and we'll stop this pandemic. So that's all I have to say. I'm going to turn it over to Knox Andrus.
Thank you, Dr. White. I appreciate your comments so much. And so what I would offer as the Region 7 Hospital Preparedness Coordinator is to share that hospitals have resources right now, but they're limited resources. And as the COVID pandemic continues, those resources are increasingly drawn upon. And so we have to learn how to make best use of those resources. Sometimes it means doing things that we wouldn't normally do, such as wearing the same mask between the same group of patients that have similar symptoms, when normally we would change our mask and our PPE between each and every patient. So the hospitals are doing things to organize to be able to respond to the numbers of COVID patients that are starting to come in. We expect that to continue and to climb and increase, as Dr. White shared. So we're strategizing on how to be able to accommodate those patients and their resource needs. So we're looking at collaborating with our other hospital partners that many don't hear about as frequently as the big hospitals. We're also partnering with our ambulatory surgical centers, which represent resources. And then ultimately looking down the road, and perhaps at some point in time we establish something called a medical monitoring station. You may have seen something about that occurring in Newell. And so we're investigating all the possibilities in working to expand our capabilities. But we ask that you do the right thing, that you do not socially congregate, that you socially distance appropriately. Please don't run to the local store to hang out or to go visit. Can't stress this enough. You may think that you're invincible. You may think, well, I don't get sick. Heck, I haven't had the flu in years. You do not know this with this disease. You need to maintain your distance. You need to wash your hands. Don't touch your face. Everything you can to keep from getting sick, or to keep from someone else becoming ill, a loved one. We don't want to transmit this disease if at all possible. So please practice those good habits. Reduce the draw on the hospital resources. Call your medical provider if you think you're ill, or if you have a question. Don't run to the emergency department, please, to get checked out there. Look at the urgent care centers that are out there. We have many great resources that are out in the community. So we ask you to do these things. That would be very helpful. Thank you very much, and I'm going to turn it over to Dr. Wilson.
Okay. Thank you. Good afternoon, everyone. The health, safety, and welfare of our citizens of Caddo Parish continue to be our first priority. We urge everyone to stay safe and stay at home whenever possible. Limit your activities outside of your home and across the parish unless it's absolutely essential. Most of the parish buildings continue to be closed to the public access. We continue to respond to emergency animal calls, and our compactor sites are operating at adjusted hours. Please visit the Parish of Caddo website, caddo.org, for updates on closures and updates on parish services. And also, I'd like to re-emphasize what Dr. White was saying about young people. Young people, please give this matter serious attention. To comply with the governor's mandate is a matter of life or death. And we certainly value everyone in the parish's life. And what we have to do our part to ensure we limit the risk of spreading this virus. And we have to, for that matter, do things that's not normal. It's not normal for a lot of us to deal with what we deal with right now. But the reality is we want to get back to normal. And the quickest way to get back there is to fully comply with the governor's mandate of keeping the social distance and staying at home at all costs. Thank you. Mayor Perkins.
Thank you, Dr. Wilson, and thanks to all the other community leaders that are on the line right now for joining us today. Not much has changed with the virus except for the continued devastation that it's causing in our community. It's disrupted our way of life. It's closed our schools, churches, and businesses across the city. In just 19 days, we've seen cases rise up to 242. And it's not just a number. Those are our friends, our family members, neighbors, and co-workers have been affected by this virus, and sadly 7 people have died. This is a public health emergency unlike anything we've ever seen in our lifetimes. We cannot just look the other way and expect this virus to just magically go away. The curve will not flatten that way. Each one of us has to take the situation seriously and do our part. We have to stay at home, reduce our numbers of trips to only the most essential, and practice proper social distancing when we are out. There are people who have husbands, wives, children that go to work every day to protect us and provide us with essential services like solid waste workers, first responders, doctors, nurses, and they're putting their lives on the line to keep us safe. The least that we can do is stay at home and keep 6 feet distance between each other. That's why I've authorized the Shreveport Police Department to start issuing summonses to individuals and businesses who are not limiting gathering size and practicing proper social distancing, as was talked about in yesterday's press conference. We will not tolerate people loitering within the confines of businesses. We will not look the other way while businesses disregard these limitations on gathering sizes or herd customers into checkout lines without any effort whatsoever to put safe distances between them. If you are an essential business and you are permitted to be open at this time, please don't continue to operate as business as usual. Put in the appropriate measures to protect your employees and the customers in our community overall. For example, if you have a drive-through, please utilize that drive-through. If you have a checkout line, be sure to set up tape on the floor or something so that your customers know not to stack up on one another, and try to limit those that are within the confines of your business. If you see a group of 10 or more gathered in one business, ignoring the governor's order, please call Shreveport Police or Crime Stoppers. Crime Stoppers can be reached at 673-7373. The Crime Stoppers hotline is particularly helpful for employees who want to remain anonymous when reporting their employer. So please utilize the services so that we can all stay safe. At this time, I'd like to pass it to Councilwoman Fuller so she can talk about some of the volunteer efforts that is taking place in the community right now.
Thank you, Mayor, and thank you for your leadership. Right now, we have a lot of groups that are nonprofits that have continually been working with those who have the most needs in our community. And a lot of times they would want to have volunteers, but right now our safety is paramount. And what is really needed is resources. If you go to the United Way website, United Way of North Louisiana, or to Community Foundation of North Louisiana, you will see that there are emergency funds set up. The Community Foundation has set up a fund to help our critical needs through the charities that are working for emergency responses right now. And that's organizations like Council on Aging, the Food Bank of North Louisiana, and other groups that are working with the most vulnerable. The United Way also has a volunteer form set up in addition to their fund to help those that are income-constrained working families. On their volunteer page, though, what you get an opportunity to do is virtual volunteering. If you want, you can sign up to actually read a book on video that they can keep in their catalog for kids that are under 7 years old. So if you have picture books at home and you want to sign up, you can sign up to do that. There are a few other volunteers, but they might be reaching capacity. But one is for the 211 website to take information calls, so you would be able to help when they have needs for additional volunteers. But I don't know that they really need those right now, but really it's for the reading. But if you're able to give to those groups so that they can help fund the needs for our critical nonprofits, that would be wonderful. Additionally, I want to congratulate the groups that have pivoted to do shields for PPE. That's Louisiana New Product Development and Sanctuary Art Studio that have been making shields that they can donate or sell at cost for medical and nonprofit social work groups that are in need of PPE right now. And those are our local groups that I wanted to just say thank you to. Thank you, Mayor. That's all.
Thank you, Councilwoman. I appreciate those remarks, and thanks to the community, those people that are stepping up in a big way right now for doing that. I simply want to conclude by saying it's okay for our citizens to be sad right now if you're experiencing some sadness or some anxiety or even anger. I mean, a lot of parents in our community are worried about how they can pay their rent or putting food on the table for their families. Like, we understand it. Some families aren't able to be at the side of their loved ones as they are getting sick right now. These are extremely difficult times for all of us. And during these difficult times, we need to fall back on our support systems. We need to pick up the phone and call a friend or a family member or a counselor or a clergy. If you think you need some counseling, there are free counseling services that are provided by the state. You simply can call 1-866-310-7977. I'll repeat that number, 1-866-310-7977. That is also why we are hosting an interfaith community prayer this week. We're bringing faith leaders from around the community together virtually to lift up our spirits and light the way during this dark hour. I invite everyone to join us on Thursday at 7 p.m. on Facebook.com, Mayor of Shreveport. The Bible does tell us that faith is confidence and what we hope for and assurance about what we do not see. The Bible also says that faith without works is dead. If we can combine faith with good works, I'm confident that Shreveport will flatten this curve and we will overcome the challenge that we are facing right now. At this time, I'm going to open it up for questions from the media.
Okay.
The first question will come from Mario.
Yeah, this is for Knox. Knox, what's the estimate on resources currently reaching a critical point, let's say in the next 10 to 7 days?
So, Mario, am I unmuted? Okay. So, it's hard to make exact predictions about when your resource shortages occur, when your medical resources actually occur. We've been working with the state, who's actually putting a model together for us that is being put together by a bunch of powerful thinkers to help crunch our numbers and make those predictions. The folks in New Orleans are getting hammered first, and so we're watching the data from New Orleans because that, to some effect, will filter to us. And so we can't actually tell you and give you a day right now of when we're going to be short on ventilators. Right now in Region 7, we have anywhere from 200, around 200 vents, and we may have more. All of that's relative to how much data gets reported to you. We have several limitations on some of the data that we collect, and some of it has to do with who's inputting the data. But anyhow, so we're working on that. We're keeping tabs on generally what we think we have, and we're planning for what happens on the day that we don't have enough, as you say, maybe ventilators. So what would we do? And so we're keeping that in mind, and we're sharpening up again on what our resources are in Region 7.
So are we going day to day at this point until the numbers are more stable from Louisiana Public Health here locally?
I'm sorry, I don't understand.
We're looking at day-to-day figures and patients coming in, and also planning for that surge that you talked about last week.
Yeah. So we collect. The state collects data from all the hospitals, and we analyze that data, and we try to make predictions based on the information that they're providing, that the Department of Health and Hospitals provide, that they collect. Try to pull all that information together to help us make predictions about where we're going to go and where's the crunch time going to be. So we're trying to pull that together, but it's constantly changing because when you think you've come to a roadblock, then you have this other resource that appears, or there's another way to engineer something, so it helps you adapt and overcome to that particular situation. So here's another thing. So it seems that sometimes we get fixated on the number of ventilators. Well, you also have to say, well, how many respiratory therapists do we have? Because it takes RTs to drive the vents, right? And then there are other components to that whole scenario of you need other components that are critical to manage a ventilated patient. So it's a bigger picture than just how many vents do you have.
Dr. White wanted to provide some additional information.
I just wanted to let medical volunteers, I know Councilwoman Fuller talked about general volunteers, but if you are a medical personnel who is not able to work, perhaps because your office has been closed or you're retired, please know that you can go to volunteer to work in our area, or even to work down south where they're in great need as well, by logging on to the Louisiana Volunteers in Action, or LAVA website. Just Google it. It's real easy to find, and you can sign up and they'll call and see. You can say yes or no based on what their ask is. But if you're available, please volunteer to help. You're really needed at this time.
We have a question for Sheriff Prater and Chief Raymond. We'll start with Sheriff Prater. It's from KSLA. Sorry, they're having a connection problem. So the question is, what about big box stores? Major grocery and department stores are often packed. Should they be following the governor's guidelines and not allowing 10 or more people at a time?
Well, it really all depends on common sense and the space. A huge place like that could accommodate more than 10 people. But it's like I say, and there's areas of the store that possibly we may end up getting them tape off or rope off. We're trying to get people to comply without going in like Big Brother. We're not used to being Big Brother. We don't want to be Big Brother. We're wanting people to comply because it's the right thing to do. And I expect the Lowe's and the Home Depots and the other places that are there, I expect them to be taking all sorts of precautionary methods and things as far as they go forward, as far as people can't stand close to each other in line. If there's any way to bring things to curbside, we want them to do that. We want to make sure that people aren't just in there shopping because it's springtime. We want them in there shopping if their toilets are broken and they need to fix something on their plumbing. And we can't go in and police each and every little item like that. I know that's a long answer to tell you that we have not taken it nearly as serious in the enforcement realm as we can by the statutory Louisiana state laws. We don't want to have to do that. We're asking, please comply and don't make us go in and cause a confrontation.
Chief Raymond.
Yeah, I don't think I can add any additional language to what Sheriff Prater stated. There is guidance for supermarkets and these large box stores that are considered essential. That certainly I can anticipate you're going to have more than 10 people in one of these large businesses, and it'd be difficult to even operate efficiently with fewer than 10 people if you include workers. But practice social distancing to the best of your ability, and be cognizant of how many people you do have in those stores.
Dr. White wanted to add something.
Just, Chief Raymond is correct. There's all kinds of guidance out there for these kind of stores. If they go on cdc.gov and Google guidance for large stores, they have it for you. They can help you in how to make your place as safe as possible for the public.
We have a follow-up question from Mario for Sheriff Prater.
Sheriff, how's the condition of the 2 deputies, or the number of deputies that were reported to have the COVID? Are they okay? Are they waiting for tests?
Yes, we've had a total of 5 that work for the Caddo Parish Sheriff's Office that have come back positive. We have taken the precautions that would make sense, that are logical, and notified people that were even possible contacts of theirs. So everyone within the department and within the public has been notified if they were even remotely 35 deputies, when I say deputies, throughout the sheriff's office that are in quarantine now, self-quarantine, and we have no one that's in serious condition. So all is well.
I hope they're going to be okay, Sheriff. Thank you.
Thank you.
So we have no additional questions, Sheriff.
Thank you. All right, well, if that's going to conclude the press conference then, and we appreciate that, appreciate everybody that took place in it, and the media, and trying to get our word out to please comply. Don't make us come in there and do something we're not used to be doing, and that's get in your personal life. That's not what we want to do. We're not used to doing that in law enforcement. We don't want to do that. These are unusual times, so please just comply and stay home or stay in your neighborhood there, away from folks, and make our job easier, and we'll all get through this, and everybody be smiling at the other end.